We're very close to completing a plan to open our country.
As President Trump considers reopening sectors of the economy, health experts warn we don't yet have robust enough testing to track the coronavirus.
You know, there are lots of us who are still scratching our heads because I would have expected us to be able to ramp up our current testing much more rapidly than we have been.
Even the nation's top infectious disease doctor, Anthony Fauci, telling the Associated Press, we're not there yet. The president rejecting the idea of nationwide testing earlier this month.
We're talking about 325 million people, and that's not going to happen, as you can imagine.
The U.S. still lags behind South Korea and Italy in testing per 1,000 people. This comparison compiled by a group at Oxford University.
We thought we had the problem covered.
Dr. William Schaffner is a leading expert on infectious diseases.
We had lulled ourselves into the sense that we knew where the virus was in this country, and we did not anticipate early enough the asymptomatic or mildly spreading virus that really ran right past us.
The result, incomplete, inconsistent data.
It's been a great disappointment. I'm baffled by it. We need a very thorough after-action report when things calm down a little bit to look at all the issues related to our somewhat faulty response.
Without a centralized process to get states the right amount of tests, manufacturers are sending their tests to multiple competing agencies.
We have to do cast a much wider net to all the different departments of health, all the different states.
Andrew Benson works for Co-diagnostics.
You can fit 5,000 tests in a bottle about this big.
A company making liquid-based tests for the virus, so-called PCR.
What further would help you all get tests like the ones you make into labs more quickly, more efficiently, should we have another pandemic?
Preparation in advance. I think now, having gone through this experience together, I think we'll more readily accept what may become a new reality, which is when something like this happens, we need to react quickly, we need to react efficiently.
How do we do this testing? How does that come up to scale? I can't do it.
The fragmentation leaves it up to states to establish individual testing and response plans. Massachusetts, for one, plans to hire 1,000 people to track down everyone in the state with confirmed coronavirus and trace their contacts. But experts say that information is only as good as the testing, and reopening the economy relies on it.
In each area, it will probably be a graduated phenomenon. Some things will be tried, we'll watch and wait, and then we'll open it up wider as we get reassurance, I hope.
James Packard, Newsy, Chicago.